So replacing a single tooth with a dental implant, what are the advantages over traditional partials or bridges?
Well, the main advantage is that we're not destroying healthy teeth to hang a bridge on. And having the immediate implant, what we can do is actually immediately take that root out, that disease root out, and replace it with a tooth that functions just like a natural tooth and looks like their own teeth. And they can walk out chewing and smiling with it.
Now, this is your expertise. I guess you invented this immediate tooth replacement, single tooth implant 25 years ago.
Yes, yes. Prior to my invention, the option was a screw that you have to wait for months for the bone to grow and osteointegrate, attached to it. My invention was this expandable screw that we placed right away and expanded and locked it in bone. And by doing that, we can place a crown on it right away. So the patient gets the tooth right there, and we prevent bone loss, gum loss that occurs with the traditional implants where you take it out, take the tooth out, and you don't place anything. That halo-shaped gum, the papilla that we call, all of that is gone. It takes months of surgery to bring that back. And this makes it much more cost-effective because we prevent that from being lost, and so you don't have to pay for it to be recreated.
So this can be done in the back. What about the front? Could you match those up?
These are specifically for the front.
Oh, really?
In the back, it's not that important for the shape of the gum to be perfect. So some patients might decide to, it's okay to wait 2-3 months for it. But our glory is that in the aesthetic zone, 20 front teeth that you smile with, which is very important to have perfect aesthetic results, you can offer this immediate tooth replacement.
So they walk in, and if they need an extraction, remove the tooth, and then just get a tooth, and you put the crown the same day and they leave.
Absolutely.
And really nobody else is doing this, you're saying? Very few people.
Very few people. As I said, if somebody does this without the Sargon implant, always comes with a big risk and with a big explanation that you can't chew with it, you can't touch it, and the patient is convinced that this is a risky procedure. If you want to do it, we'll do it, but we recommend the traditional way of going. But this is the only implant, the Sargon implant, because it expands, it locks.
This is the one you invented?
Yes.
Okay.
It can predictably do that. So that's the one that over 90% of our cases, when they come in with a bad tooth, we can replace them with a brand new tooth, and they can walk and chew and smile right away.